Uterine fibroids are extremely common. They are sometimes more common in certain ethnic groups. Specifically, African American women can get fibroids pretty commonly. And what fibroids are benign tumors or growths of the uterus, and they can be quite large. They can cause significant symptoms. Typical symptoms are heavy menstrual bleeding and cramping, as well as pressure on adjacent organs, including the bladder, which can cause bladder symptoms like frequency and urgency. Sometimes patients will have other symptoms like constipation related to their fibroids or even back pain related to their fibroids. So a uterine fibroid embolization, or UFE, is a minimally invasive procedure where we go in through a little puncture, typically in the wrist, and we'll go down from the wrist into the pelvis where the uterus is located, and we'll identify the abnormal arteries that are supplying the patient's fibroids. These arteries are pretty typical looking, and once we get our catheter and our other devices into these arteries, we'll inject small particles similar to grains of sand, and those particles will dramatically reduce the blood flow to the fibroids, causing them to ultimately shrink, and more importantly, causing the patient's symptoms to be relieved, including the heavy bleeding and cramping and other bulk symptoms, as we call it, related to the fibroids. So here at Texas Endovascular, we recently had a patient that had very large fibroids, and she was told by her OB-GYN that hysterectomy was her only option. What was interesting about this patient is she was a former track athlete, and she used to have just a flat belly, a six-pack, and now had these large fibroids where it looked like she was pregnant. She was otherwise very fit, but had this large fibroid uterus that made her look like she was 6-7 months pregnant. So she came to us because she absolutely did not want a hysterectomy. And we did the procedure as an outpatient. It took about an hour or so. We went through a little puncture in her wrist. She recovered at home, and then over the next several months, her uterus and her fibroids started shrinking back down to where she had her six-pack back, and she was absolutely ecstatic about that.